Welcome to the Labour Force. I am Bongeni Muchwa. Business for South Africa has hailed the success of the COVID Vaccine Rollout Programme in the mining industry. 45 mine-based vaccination sites have been opened and are operational at various mines, with a further 14 sites in the pipeline. The mining industry is a major employer in the country, with more than 500,000 people employed. As such, it is regarded as a crucial target for the country's national vaccine rollout program.
So we've been working very closely as B4SA with the Minerals Council of South Africa and all of its members, recognizing that the mining sector is an absolutely key sector with the facilities to be able to vaccinate not only their own workforce, who are obviously very much at risk, but also the families, extended families of those workforces, as well as the communities within which they are located. We've brought nearly 50 companies through the system and the process of making sure that they're accredited, licensed, and available to administer the vaccines. They've done so in a most ambitious manner. As was announced, they've vaccinated now over 100,000 people. They'll become open sites, the vast majority of them for the community at large.
The employers say unions have an important role to play in helping to overcome vaccine hesitancy at the mines.
We see organised labour playing an absolutely crucial role in overcoming any obstacles. And by the way, vaccine hesitancy is not that people necessarily are not comfortable to take the vaccine. In many cases, it's a question of the convenience, the ability to actually take the time out of their busy days to be able to go to a vaccination site that may not be convenient or accessible. And organised labour has got a critical role to play in that regard.
Vaccine hesitancy has emerged as a serious challenge for the national vaccine rollout program as the country braces itself for a possible fourth wave of COVID-19 infections later this year. Bongeni Muchwa, SABC News, Johannesburg. I'm joined by Dr. Thuthula Balfour, Head of Health and Safety at the Minerals Council of South Africa. Dr. Balfour, of course, you are no stranger to the show. It's a pleasure to see you again. Welcome back.
Thank you, Mbongeni, and also afternoon to your viewers.
Now, of course, the country at the moment is experiencing the third wave of infection still in different parts. So before we get into the vaccine rollout program in the mines, please bring us up to date about the number of infections that you are seeing currently at the mines, and of course also the number of deaths where we're standing now in terms of the count so far at the mines.
We are around 85,000 cases from last year, and we are just over 600 deaths that we have experienced. And our epidemics really have been different in the various provinces, similar to South Africa, where, Gauteng was ahead, and the mining provinces, which are Mpumalanga, Northwest, Limpopo, they were ahead of the coastal provinces. So our epidemic has, in a way, been mimicking that of the country. But those are the figures at the moment.
Are you coping at the moment, would you say?
We actually, if we look at the first wave, the second wave, and this third wave, the peaks that we reached in those previous waves, the worst wave was the second wave, the one around December, January. We are finding that, this second wave, yes, it is there, it's significant, but the peak we are seeing is not as high as we had in the second wave, which therefore makes it possible for us really to manage within, the resources that we have, because we were fairly stretched during the second wave. And so with a lighter, or let me say lower third wave, we are actually managing.
Now, over 100,000 mine workers have been vaccinated so far at the mine sites, and you regard this as a significant milestone. Please explain.
We are actually quite excited to find that as of now, we've done 105,000 vaccinations out of a total population of about 450,000 mine employees. And we think it's even more significant because most of the companies, it took time for their sites to be up and running. So a lot of the sites were only active from July. And for them to have really managed to push so many vaccinations, I think is really quite encouraging. We have a company that has vaccinated over 80% of its people. Some are pushing on 50% of the people being vaccinated. So at this rate, really, we are quite optimistic that the 80% that we have set for ourselves will be reached, hopefully by even end of September, because it is quite possible with a concerted effort. But even maybe putting it towards October, but definitely we've seen very good performance from the companies. They've put in a lot of effort, and I also need to recognize that it's not just the companies. The organized labor is a very crucial part of this, and also the employees themselves. Not to also leave out the Department of Mineral Resources, which of course, is our mother department, but more involved is the Department of Health.
Listening to you, one would get a sense that there's enthusiasm for the program from the mine workers themselves. Is that the case? Are mine workers flocking to the sites, the vaccination sites where they exist at the moment?
You find that this varies across sites, but as I said, there are companies which could vaccinate 80% of people in a very short space of time. And at the moment, I wouldn't say we have a lot of vaccine hesitancy. I think it's more about information, education. With information and education, people then see the need to vaccinate. So
now, briefly, before I let you go, Thuthula Balfour, and before we run out of time, in terms of opening these sites to family members and the local communities, how crucial is that?
It's important. Some of the sites were set up so that they would be able to vaccinate dependents and also to vaccinate the communities. And that has been allowed already by the Department of Health, that companies can vaccinate those dependents. And so I think that's the other reason that we would want to make sure that the employees are vaccinated and, we then are able to move on to assisting more of the dependents and the communities.
Dr. Balfour, it was a pleasure to have you on the show. I appreciate you making time to talk to us, and I wish you luck with your work out there, and please do have a good day.
Yeah.
Well, before we go, we've just learned that the office of the CCMA in Rustenburg has been shut down following an unfortunate incident where there was a skirmish between members of AMCU and NUMSA. That's what we are learning. Apparently, some shots were fired, and it seems like one person has died as a result. The number of injured people at the moment is still being verified. We will be getting more information for you on that unfortunate incident later on in the day.